No.
You're a wonderful human being, and not just because you brought me that.
Okay, all right.
Are you having people serve you coffee? Let me just have a breakfast muffin for you or something.
Oh,
That's not bad. It's the best offer that I've had so far.
you might be onto something,
It's not
Jerry.
too bad.
I already ate it.
This one too. So this, I just did kind of breakdown.
Oh,
For cases for schools, what that means per person for 2 weeks.
does it really mean 27 or less per day?
28, because it was rounding up.
27.5.
Yeah.
27.7.
Is it 28 per day or 9 per day?
Yeah.
Steve, so you have the current at 179. Yesterday was 201.8.
That was from yesterday's, or this was.
You went down 20.
Yeah, that was the data that I used. There's a date on that. Good. August 2nd through 15th. So.
As I said, when I looked at it yesterday morning, it was 201.8.
Yeah. Oh, from the governor's website?
Yeah.
This was just calculating it based on our current cases.
Okay. Okay. Why the discrepancy, do you think?
Because they're behind a few days on it.
Pretty behind. Big difference.
201.
Is I guess, all right, let me get the meeting started here. Good morning. Good morning to our folks on GoToMeeting. Thank you for joining us. I'm going to go ahead and start with an agenda review, and then we can get started. So I have a health officer update with Dr. Lutz. Steve's going to walk us through the dashboards. Then over to GSI and Alicia for any updates that way. And then our open discussion today, I do have a couple of guests here. I have Helene Dewey and Heather Gallagher to talk about some of our efforts related to health equity and what that means with COVID and how we're reaching some of our different communities. And that's all I have. Does anyone have anything that we need to add to the agenda?
Amelia, this is Arian Schmidt. If we have time, might want to just give everybody an update about how the next stage of healthy sheltering is going, and just kind of an idea from Dr. Lutz about how long that Washington state and local provision will be in place so that we can chew on it for kind of our plans for the months ahead.
Okay. Yep, I got that here. We'll add that in. Anything else?
Yeah, I know. I don't know if this will just be a question for Dr. Lutz when we get to his report, but just trying to get a little bit more insight into schools.
Okay. We can do that, Mayor Wick. And I also know that in Steve's data, he has some additional, he has the metrics for schools included, so we can talk through that there as well if we don't cover it with Dr. Lutz. All right, so.
You have Steve go first with the data. I think it'll all sort of feed into each other.
Okay, all right, so we're gonna have Steve go first with the data to talk through. All right.
All right, well, thank you. So from the previous week, it's looking better as far as numbers go. There were 350 total cases, which was 230 fewer than the previous week, with a daily average of about 50, as opposed to 83 the previous week. So the trend is definitely on the decline. For age groups, the only really group that we're seeing with an increase is that 10 to 19-year-old, as well as the 40 to 49-year-olds, so kind of bookending the 20 to 29-year-olds. Race has stayed about the same as far as cases recently. Our rate per 100,000 of newly diagnosed cases during the past 2 weeks, as of the 15th, was 179.72 per 100,000. I'm still not meeting the goal of 25 per 100,000. Our EpiLink has gone down a little bit to 64%. For hospitalizations, the previous week, we had 11 new hospitalizations as opposed to 27 the week before. There are currently 57 hospitalized in Spokane County, of which 33 are Spokane County residents. There were 13 new deaths last week, mainly in the older age groups, but that is down from 19 deaths the previous week. We usually give updates on testing. The testing metrics are being changed by the Department of Health right now. I'm about a week behind, so I'm not going to provide an update this time. For the healthcare system readiness, our licensed beds occupied by patients is about 65.1%, which is meeting the goal of less than 80%. We have total licensed beds at 1,399. Licensed beds occupied by suspected and confirmed COVID-19 cases again is at 57 as of yesterday, which is about 6.3% of beds. For care coordination, we had a total households today. Well, should I wait for you to provide that update? Okay, they reached 270 people. They have 270 total cases, 164 that are open, and they closed 39 in the previous week. Regarding food security, there were 733 new applications. Poundage has also gone down from second harvest distribution. Childcare, we're holding pretty steady. The percent of childcare centers closed is about 22. It's down a little bit. The birth to 5-year-old programs closed has gone up quite a bit to 31 from 16 the previous week. 5 to 12-year-old programs closed is at 28, which has actually gone down significantly from 81 as people are preparing for school. And then vacancies in childcare is about the same. For unemployment insurance claims, between August 2nd and August 8th, there were 1,283 new claims, which is down from 1,599. So that's my general overview of the data. If there are any questions.
And Steve, sorry, but for the group, I think that the metrics for classes and metrics for schools, did you hit those?
Didn't really talk about them. That is that rate over 2 weeks. So right now we're at the 177 or 178. And we're at 179. So right now it's showing about 177 as it goes down a little bit day by day. But just a kind of general overview on what that means to reach the different levels that we want. So if we're looking for 75 cases per 100,000 residents, we're talking about 387 new cases per 2 minutes, or conservatively 28 per day, 28, 27, depending on how you round. To reach the 25 cases per 100,000 residents, we're looking at wanting about 129 cases per 2 weeks, or 9 per day. So we're well below that.
So questions on the metrics? Yep, Mayor Wick.
So when we went from phase 1 to phase 2, I thought there was some discussion of outbreaks didn't count the same as regular cases. Is that the same still now? Is there some of those cases that we have considered outbreaks? Or I see a head shaking, so maybe I'll stop there and just let you answer, I guess.
They always counted the same. I mean, we don't differ. I mean, outbreaks are outbreaks. We're certainly concerned about those. There's certainly something that we have to address. The focus on outbreaks, however, has changed since we have so many outbreaks in contrast to early on. So that sort of prioritization has been lessened. Certainly, as we have major outbreaks, we're certainly going to be addressing those. But given that the definition of outbreaks is so easily met when you have a couple of cases, it's no longer like the major focus as it was going from phase 1 to phase 2.
Yeah, Jerry.
You mentioned that you don't have some of the information because they're changing the metrics.
Mm-hmm.
What are they changing from what to what?
So the Department of Health is redoing how they count testing. It sounds like they were only counting individuals if they've been tested as once, even though they may have been tested multiple times. Now they're going back and reviewing that. And so the amount of tests that we do per day will be a true amount of tests that go through that they reported.
Thank you.
Yeah. It used to be unique individuals and now they're going to unique tests. Hopefully they'll have that updated by the 24th. So right now on the DOH website, they don't even have that metric available because when they updated it, it made it look like we were barely doing any testing at all. So.
Thank you.
Commissioner French, looks like you had your hand up. Yeah. Oh, we can't hear you. Hold on. Okay, go ahead. Oh, we still can't hear you. I wonder Commissioner French, do you know which caller you are? What callers are unmuted? Okay.
I think it must be Al, I think it must be something with your microphone because your green logo is on as if you are unmuted, but we cannot hear you.
Right. Thank you, Commissioner Kearns. Was there another hand up while Commissioner French works on his microphone? Sorry,
Maybe he could type in this on the chat. He could type this question or comment.
yeah, because you can also type in questions into the comment box.
Call you.
Or call Jerry. Jerry's in here with a cell phone. You want to call his cell?
He knows the number. So do I.
I think Mary has a comment.
Okay, Mary. Yes.
So Steve, with the change in metrics, so one of the things I know, I had a friend test positive for COVID, and she was told that if she were to go back and test again, she would potentially test positive for several weeks. And so I guess if the metrics are that they're going to count, would that count then as a second positive test for her, and because I mean, we don't want to have that when.
No, they won't double counting the positives. So they won't count that as a new case. They'll just say that she got tested again. That will go to the testing metrics, not the positivity rate.
Okay, because I know some employers are wanting people to test until they test negative before they can come back, and that's, I just wanted to make sure that with the new metrics, if they're recounting that because that would be a second positive test, but the new metrics, so it sounded like they're counting that as a test.
They're just counting that there was another test conducted, but the positivity rate is over unique individuals.
Okay, and then on schools, I think we need a message out there because I mean I've got a lot of superintendents and a lot of people thinking that our numbers are coming down, so we're going to be able to get there here fairly quickly. I think we need to be kind of like you guys were talking ahead of the meeting actually starting, that the state is behind us, and we know that. They're a week behind. Is that correct?
I missed the beginning of the question.
So we know the state's metrics are about a week behind us, that they're calculating it that way. But with our numbers coming down, I'd like to make sure that we're staying on top of it and calculating it every day. I mean, obviously, thank you for sharing the calculation. So I'm calculating it myself every day based on the numbers that are being presented on the website. And so as we see those numbers come down, and knowing that it's 387 total for 14 days straight, I think a lot of people think that as those numbers, we saw 24 yesterday, 19 on the 16th. As those numbers are coming down, they're like, oh, but we're below 75 per day, so we should be able to get there. And so I think we need to do a really good job in messaging that to our citizens. So that way they're really understanding what that metric is, because I think there's been a lot of confusion on that. But, we just think our numbers, because basically since the 9th, we've been under, 75 75 today. It's been 50, 36, 55, so people are thinking that we've been there for a while, so shouldn't we be able to start to get, elements open? So I think we just need to be really good. We need to look at how we message that, because there's a lot of confusion. I'm getting a lot of that. And so just stating that for a fact out there.
Thank you, Commissioner Cooney. I wrote that down as something maybe after this, I can talk with Kelly, our PIO, and Dr. Lutz, and kind of come up with maybe some messages that we could put out so that people have a clearer understanding. Commissioner French. Yep.
Okay, Al.
Yeah. So basically, I've got three questions. One, turnaround time on testing. Two, I agree with Commissioner Cooney. My daughter contracted COVID in Southern Idaho, and they discouraged her from getting a second test because it shows up on the numbers for their count and stuff. And then the third question is there any county in the state that's meeting the 25 cases per 100,000?
Okay, so the first question, turnaround on testing.
Yeah, Commissioner French, it's better. It's still variable. Because of the issues that arose a couple of weeks ago where you had significant turnarounds, for example, if you were going to Quest Lab in California, it was taking 7 to 10 days. LabCorp was taking 5 to 7 days. Those turnarounds have improved. Again, ideally, maybe 2 to 3 days. When I was on a state call last week, they were saying the median was about 2 to 3 days across the state, but it's still somewhat variable. It's better. It's not ideal. So that's that point. With respect to the testing, and again, this goes back to Commissioner Cooney's comments, and I would put this out to all who have interactions with businesses. Please strongly discourage them from asking/requiring that their employees have a negative test before returning to work. It's not indicated. The CDC early on, the CDC had two criteria. You could either have what's called a time-based or a test-based strategy. The time-based was, again, based upon symptom-free for 10 days without fever. At first, it was 72 hours. Now it's 24 hours. The test-based strategy is problematic. The median time for test negativity is 21 days. We've had people test negative for up to 3 months, and that's not viable. What ends up happening is the PCR test is merely detecting viral fragments. It's not necessarily detecting actual viable virus. And so that is, again, one of the problems that we continue to have. We've had it with long-term care facilities, with skilled nursing facilities where they are unwilling to take back individuals from hospitals. And again, it is problematic at the work site because of employees being asked or required by their employers to have those negative tests. So please discourage that. We've tried to get that word out, but there's still sort of an inherent practice of requiring that. And then the third question
Was about any county.
it's
Steve's actually.
Yeah. So it looks like there are 5 really small ones. Right now it's Columbia, which has had barely any cases total, Wahkiakum, Island, Jefferson, and San Juan.
Soton is right around there. Soton was
really close, but yeah, just slightly over.
Yeah, we had like 6 cases last week, which put us up over the limit of 25.
Any follow-ups from that? I just want to make sure, Commissioner French, it looks like you're nodding, so I'm not sure.
He's good.
He's good. Okay. Mayor Freeman.
Just real quick, Dr. Lutz, is that 25, given the prevalence of COVID now, is that 25 per 100,000 a reasonably achievable metric anytime in the near future?
For whom?
For anybody. Other than Columbia County, where there's more cows than people.
I think you've spent a lot of time in Columbia County, Mayor Freeman, so you would know better than I. Yeah, I mean, it's a tough metric. I mean, if you think about it, that's also the metric that was suggested to go from phase 2 to phase 3. And so, right now, for example, if you look at our test positivity, it's, in the double digits. So we still know that COVID-19, the prevalence of COVID-19 is high. So I think that 25 per 100,000 for 2 weeks is a very difficult metric that any county that has had a significant uptick in cases is going to see in the foreseeable future.
Okay, I can't read.
I can read it if you want
Can you
to.
read it?
Yeah. It sounds like the back to school metric is less than 75 cases per 100,000 population over 14 days. So by my calculation in Spokane, it would be less than 27 new cases per day on average over the 2 weeks.
That's correct, Councilmember Biggs. It's just, it depends on how you round. It could be 27 or 28. And then Sarah just put a comment.
That was previously.
Oh, okay. Did we cover it, Sarah? You good? Okay.
And Amelia, and I would say getting under that 75, that based on the decision tree, that is just for elementary to open. It's not for middle and high school to open, just to be clear.
That's incorrect.
I'm sorry, Dr. Lewis.
I mean, the metrics are cut points, and then you have to look. I mean, I think there's some concern that the cut points are absolutes, that we're going to look at those, and as soon as we get below 75 per 100,000, all of a sudden the dynamics change. The dynamics are going to be based upon what's happening. And, the reality is that the concern is that with colder weather coming on, more people getting indoors increasing the risk of congregated activities. We know schools oftentimes have poor ventilation. And so again, I think that I really want to discourage us from looking at that 75 per 100,000 as an absolute metric, that all of a sudden the dynamics change and schools can go to a different phase of opening. What they're talking about is that's 25 to 75, you can have more hybrid. Secondary will continue to be discouraged for a prolonged period of time. But again, in theory, there are school districts that are between that 25 and 75 where secondary ed is coming back.
Yeah, go ahead, Mayor Wick.
You mentioned there are school districts within that 25 to 75? You mean in other county or?
Other counties.
So is your thought then, if we start to trend downward and bring the case count down, that if we get below that 75 per 100,000 over a 2 week period, that we wouldn't be going back for elementary school in your mind?
I think it's a very nuanced conversation, Mayor Wick. Again, I do not want us to be stuck on an absolute metric. Again, I think that's a false sense of security. And so I really discourage us from looking at these numbers as absolutes. It's very contextual. So there are other variables that have to be considered in that metric. If you look at the decision tree, it provides that metric, and then it also provides some other considerations.
And then since we keep talking about schools right now, could you help me understand early learning and how that kind of came into it? I know there's different school districts have different interpretations of what that meant.
Yeah, early learning, it depends. Again, OSPI defines early learners as birth to age or to third grade. How I've defined it, because of our rates, is essentially birth to grade 2. And so when I've been in conversation with the school districts, that's what I've been encouraging them to look at. If you look at grade bands in schools, oftentimes it's K2. It's oftentimes then grades 3 through 5, or grades 3, 4, and then 5, 6. So I think, given that a number of school districts have given consideration to that early learner phrase, what I've been encouraging them to look at is, again, pre-K up to grade 2. But OSPI does define it as birth to grade 3.
And then in that encouragement, are you encouraging them for more of a hybrid model, even in that band, or what's your kind of encouragement that's going on?
Yeah, I especially early on, if schools are interested in bringing back early learners and or other youth, that again, that in-person experience is much better, is necessary than a remote learning format, then what I'm suggesting is you start off slowly in a hybrid version. So for example, yesterday, working with a school district, initially what it was presented, it wasn't a school district, actually it was a private school. They presented to us an idea of bringing back K2 5 days a week, 5 half days a week. We discourage them from doing that to start off with, just because for many of these schools, this is a whole new approach. And I think a lot of processes and procedures have to be, vetted and ensured that everything is safe in those schools. So we went and encouraged them to look at a hybrid version. And what they did, Mayor Wick, was essentially they went from a 5-day in-person schedule to alternating A and B days, half days, and then the second half of the day remote, and then the 5th day fully remote. So I think there's lots of variations on themes. What we've been encouraging them, however, given this is a whole new form of learning, is that you start off slowly, you look at the community dynamics, you look at what's happening in the school itself, and then, in conversations, we look at maybe moving forward slowly.
And then last one was, I know there was a study early on about schools and kind of from the modelers, but it was really looking at a 5-day-a-week model. There was discussion about doing another study for these hybrid models. Has that been released or?
Not yet. It's in the works. It's in the works, Mayor Wick. I thought it was going to come out last week, but it didn't. I know that they're working on it now. It may come out this week. It may come out next week.
Okay. Thank you.
Okay, any additional questions on schools or for Dr. Lutz? Okay, do you want to, Arian had a question on healthy sheltering. Do you want to go ahead and?
Yeah, Aaron, could you repeat the question then?
Yeah. It was just city of Spokane in particular.
You're frozen.
Did some.
Arian, you're kind of frozen.
Claire.
No. Mm-mm. Sorry, no.
That we've had some conversations with the city of Spokane. Can you hear me or no? Allie,
Hear you. We can hear you now.
that helps. Okay. Did that? Okay, I turned off my webcam. I just wanted to share a recap from a meeting last week that some efforts that were, I would say, tasked last spring by the EOC, that we have decided that a phrase that we'd like to present to the group, since this group is now kind of overseeing the recovery efforts, is ongoing regional COVID mitigation efforts. And the largest of those is the provisioning for healthy sheltering for those entities that cannot physically accommodate for the 6-foot distance. This past week, as many of you know, we moved the arena site for about 90 individuals to a building off of Mission. And the question for Dr. Lutz is, if healthy sheltering, the 6-foot distancing is anticipated for a while, is that something that this group would like kind of ongoing briefings on, particularly related to the maintenance and operation pool for the operator or decision making, so we can consider that months in advance before we meet any sort of hard deadlines?
Yeah, Arian, if the question's specifically for me as to how long the physical distancing is going to be required, I would suggest to you that it'll be required until we have a vaccine, and or dynamics change significantly. So I would anticipate that practice throughout this winter. I can't see it changing unless we have a vaccine per some of the conversations, by the holidays, which I think is unlikely. So again, I think in planning it indefinitely is a good approach. And then I just leave it to Amelia if we want to.
Yeah, I mean, I guess, Arian, my question would be, we have isolation and quarantine happening at other places, and we haven't been reporting out on that. So I'm not sure if you would, is that what you're asking? Like, if you want to do like a report out on an ongoing basis?
I think the topic that really came to light for me is we have some folks at a staff level, I think, that are still understanding the role of this group as far as ongoing directives for provider contracting, the funding of sorts, and just making sure that this group has a leading awareness of how that aspect is going, so that we don't inadvertently get into a crunch time situation again. Everybody has the opportunity to weigh in on this particular aspect because it is a regional provision for the area. Because right now there is no other oversight group left over from the EOC besides this one. If you guys feel there's a better venue, absolutely. I just wanted to make sure that it was brought up for this group's consideration.
Yeah, I want to piggyback on that, Arian. I agree.
We can't hear you, Sarah.
Sorry, can you hear me now? Okay, so sorry. I pushed it, but it didn't click. So I agree. I totally hear where Arian's coming from. So what's going on is we're, the city and the county working together to work on this, the healthy sheltering, the spacing, that need for 6 feet between the beds, and making sure that we have maintenance and operations covered for that. What we had done before is talk to Dr. Lutz about documenting what that 6 feet distance is, so that as we work on contracts and all that moving forward, we have it documented. I've already worked with some of your staff, Dr. Lutz, and I'm working on drafting up a letter just to get on paper that you agree that moving forward, there's basically an indefinite need for this healthy sheltering spacing. But what Arian's getting at here is that there is ongoing work going on with that, and there is no oversight group except for us at the city and a few folks at the county. So this is kind of the only venue for us to keep talking about that and keeping an eye on it. It seems irresponsible to not have a one-stop shop to discuss it, even if just briefly a status report every now and then. So I think that's what she's getting at.
Yeah, I mean, I think it's appropriate to do a status report. I just want to make sure we keep clear lines about like who's working on what part of it. Because I think that in the past, there's been confusion around that. So, I mean, I'm fine if, you guys want to add that to an agenda, from time to time. I don't know that you want to do it every week, but I mean, I can leave it to you guys to let me know.
Totally. Maybe we bring it up as there's challenges or things like that. I know this meeting doesn't actually happen every week, so we'll just keep in touch and see how that goes. But yeah, we'd love to bring that to you and get feedback and clear on lines of obligations, but it is a regional effort, so this is a good spot for it. Thank you, Amelia.
Yeah, absolutely. Other questions on that? Oh, it looks like we have additional comment. Can you read those, Steve?
Yeah, from French, the Idaho Health Department is discouraging second testing for 2 reasons. One, It burdens the testing infrastructure and consumer supplies too. Remnants of the virus can remain in your system after you are in recovery and give a false positive. And as a second comment, have we been able to make any progress at increasing our ability to do local testing for the public? Does the new saliva test have any merit?
So Commissioner French, with respect to the local testing, as as we've discussed before, we're in the process. I know Amelia put in a PO a couple of weeks ago for one of the instruments, and I know there's been ongoing conversations with Providence. That'll be, I think, proceeding over the next week or two, which are.
I actually had one yesterday.
I know, right. I'm aware, yeah. And then with respect to the saliva test, it's intriguing. I know that colleagues at both Insight and then Waddle are looking at that test. It sounds very interesting. There's been a lot of buzz about that. For people who don't know, it's a test that was recently given EUA by the FDA. It's coming out of back east. And essentially it's just you spit on a stick. Literally you provide some sputum, or in this case saliva. And then it does require, however, that it goes to a laboratory for analysis. So there will be that turnaround time in contrast to being able to do it on your own, which is again, sort of something out there being looked at. So as I said, I know that a couple of labs are very interested in looking at that, getting access to it, and then it would be the process of them validating it in-house. And then once it's available, but yeah, I think certainly something that we will be following very, very closely over the next month or two.
Okay, GSI. Kira.
Oh, yes. So Alicia is on a very well-deserved vacation. I'm hoping to not hear from her until Thursday or Friday. Wanted to provide an update with numbers on the grant application that closed on Friday. We had a total set of applications. The small business portion was 1,228, and the nonprofit were 202%, or 202, which totals 14% of the total application pool. So that is well underway. All of our reviewers have been trained, and so that work begins today. And Cindy has a very detailed kind of plan to go through that work, and updating the Board of Commissioners. I think it was today, later today, is where she's going to do that. On the marketing side of things, we continue to build our asset base, and we are on the Spread Kindness, Not COVID. There's been great traction with Downtown Spokane Partnership that is building out that brand, and GSI is pushing that out countywide. And we continue to build on the assets for that. Billboards and radio and social media, and I'll get those stats later this week. Hope to provide an update on that, just a quick update next week. There will also be, we are in the process of storyboarding and filming other video assets that will be on network TV, and hoping to get those out by the last week of August. And the Marketing Support Fund, if you recall, there was $500,000 from the CARES Act funding from the commissioners. That is, we received about 6 applications last week, or actually over the course of the last 2 weeks. And we'll be running through those and getting subcontracts signed. That is for the smaller business development groups that are, that have a pretty specific constituency, and other chambers to assist with marketing efforts. So that is well underway as well. So those dollars should be allocated and out the door by the end of August.
Thank you.
Question? Yeah.
Any questions for Kira? All right. So I mentioned for open discussion today that I'd invited 2 folks here from the health district to come in and talk about our equity response related to COVID. So I'm going to switch it over here to Helene Dewey and Heather Gallagher to give us an update.
Thank you. So again, my name is Helene Dewey. I serve as the equity officer within our agency's structure, and I also serve as the logistics section chief. So just to give you an idea of some of the things that we have been working on within equity for our response, but just to give you an overview of the equity officer position and the intent is to reduce health disparities of COVID-19, to use data-driven approaches, to foster meaningful engagement with community institutions and diverse leaders, to lead culturally responsive outreach, and to comply with our federal Title VI requirements from FEMA for our response. So some of the things that we've been working on is, many of you know, as you're hearing from Steve weekly on the dashboard, is that we are disaggregating data by race now and making that information public. We're doing it by race, age, and geography. And this is to help us better understand who is being disproportionately impacted by the pandemic. We have also created a COVID-19 response equity task force. And the goal of the task force is to convene a group of people that represent communities who are disproportionately impacted by the pandemic to help inform our response to reduce unintended impacts of the pandemic. And just to give you an idea, a couple of the things that they've been able to assist us with is giving us input on our strategies within the operations of our response, with case investigations and our contract with Public Health Institute. It is now a requirement to provide training on trauma-informed care, motivational interviewing. Steve, help me out. Do you remember the other three? ACEs, adverse childhood experiences.
Yep.
And there's cultural humility and cultural competency. And then we will be working on a contract with Native Project on data sharing so they could assist in doing contact tracing and care coordination for Native COVID positive residents. And one of the things that I think folks would find really interesting is we brought in the City of Spokane and Spokane County to talk about tenant-based rental assistance programming. Last meeting was last Thursday, and Spokane County staff presented on the Department of Commerce's grant funding on the eviction rental assistance program that they will be administering here in Spokane County. And our task force members had an opportunity to provide impact and input on that process and what that looks like for us. We also received a very large cloth mask donation from FEMA, and our task force has been assisting us with distributing that locally to groups who are in need. Another thing that we have started with our response is formalizing strike teams around equity. And strike teams, as you're aware, is a emergency response tool to really put resources into, I guess, sometimes putting a fire out real quick. And that's kind of what we've been trying to do. But we're not calling them strike teams because that doesn't sound very warm and fuzzy to a whole lot of folks. And so we renamed them equity impact teams. And so the idea is when we start to see an uptick in cases within a community, that we activate these teams. And the teams consist of community folks who are part of the community that we're seeing an uptick from staff and from partners. And the idea is to make sure that we are meeting the specific and unique needs of that community to see those numbers go back down and to mitigate the spread of COVID within the community. And we work with them to identify the approaches and strategies needed in 4 different areas: outreach, prevention, and communication, testing and contact tracing, access to quality, culturally appropriate clinical and behavioral health resources, and economic and employment support. And just to give you an example, we are starting to formalize this because of some success that we've seen with the local Pacific Islander community. As you are aware, we did see an uptick in cases. It was pretty public. It was in the media. And our operations section identified that they needed to engage the community more to better understand the challenges. And they did so. And through that, and with the assistance of leadership here at the Health District, we identified what we needed to do within operations to make sure that folks who are COVID positive can isolate safely at home. And just to give you an idea of one of the unique needs within the community is access to unemployment, the unemployment pandemic benefit through the Employment Security Department. And so with working with the State Department and with local Marshallese Pacific Islander advocates, they were better able to navigate the process because it was a process that they were not familiar with. And through it, ESD ended up hiring more staff at the state level to assist local communities in navigating their unemployment process. And just to give you an idea, and we'll talk a little bit more about care coordination and what they've done to make sure folks can isolate safely at home. But just to give you an idea about how successful that type of approach is, the first week in June, we had 62% of our COVID positive cases were within the Pacific Islander community. As of this last week, it's 5%. And we know that there are limitations in data, but that's a pretty significant decrease. And the idea is that we make sure we meet the unique needs of community members who are disproportionately impacted so that we could see those numbers go back down. And also just to give you an idea too, some of the, as the work that we do with logistics, in the dashboard that you receive weekly, we identify long-term care facilities and outbreaks. We work really closely with operations. We received 100,000 KN95s from FEMA as a donation, and we are this week distributing those to our higher risk long-term care facilities. And now I'm going to pass it over to Heather to talk about care coordination.
Thank you. My name is Heather Gallagher. I'm the deputy for our community health branch, and then I'm also the oral health specialist, along with a project manager for our community care. So I work a lot with Helene.
Check this one. This one.
Hopefully you can hear me now. So we started care coordination back in June, and as Helene mentioned, most of our cases were Pacific Islander, Marshallese community, and we immediately realized that we had to really work with that community in order to help them stay home safely and remove barriers to keep them there. One of those in particular was food needs. The food being provided by local food banks were not their typical diet. So we worked with community partners in order to get them culturally appropriate foods. As Steve said, we've seen 270 families that we've care coordinated. 34 of those have required translation services, including Spanish, Marshallese, Russian, and Mandarin. We have 8 regular care coordinators, and 2 of those are community health workers, one that speaks Spanish, the other is Marshallese. We also have a community health worker who's specific for pregnant women and women who are postpartum. At our birth outcomes task force, it was identified that many women are coming in to deliver and finding out that they're COVID positive. Mm-hmm. So they're going to have to go home after their delivery and do isolation. So we have one of our nurse family partnership care coordinators actively taking care of their cases. And because many of them will still be in isolation during their first appointments, we have access for them to talk to a nurse consult and a lactation specialist. Let's see, other than that, I just wanted to give you a rundown of what the trends are for care coordination that we're seeing the most need. Number one has always been unemployment financial assistance. About 100 of those 260 cases requested help with that. Number 2 is PPE and cleaning supplies. We found a lot of people just didn't have what was needed on hand anyhow. And then lastly was food, culturally appropriate food, and water for our Pacific Island community. And that's all I have. Okay. Thank you both for coming in. I know that that's kind of a unique approach that we're taking here at the health district by having, you know, an equity chief and in addition to logistics chief, which Helene is filling. Any questions related to care coordination or equity? Yes, Doug.
So much like GSI has sort of served as a central location for business assistance, is there a central location that we can refer our residents for rental assistance?
That's a great question. I don't know if there is a general place currently. What we have found is that each jurisdiction is doing something unique to their jurisdiction. So City of Spokane is working with Spokane Resource Center. Spokane Valley is contracting with SNAP. And then Spokane County with the Department of Commerce dollars, I think has yet to choose who will administer their funds. But as of right now, I don't believe there is a one-stop shop for rental assistance.
And Medical Lake is going to use Medical Lake Outreach. I just was curious if, they ran out of funding or if there was, alternative sources for places for people to go.
And I could talk to our communication team because we do have a resource page on our website for businesses that maybe we could add one for tenant assistance.
Mm-hmm. Yep. Thanks, Doug. Any other questions for Helene or Heather? Okay, thank you both. So anything else for open discussion? Okay, so I think our next meeting, I was going to kind of take everyone's temperature, if you will, around meeting times. Is this something we want to continue weekly, bi-weekly? So weekly, it looks like everyone's shaking their head on the camera, weekly. So the next meeting would be the 25th, which I believe is next Tuesday, at the same time. All right, thank you, everyone.
Thank you. Thanks, Amelia.
Yeah.
Very efficient meeting.
My new position is the deputy specialist, and I'm in Steve's division, the quality planning and assessment. That is a new position that was created April 1st.